All right, finally, to end what has been a wonderful day, a great celebration, I welcome Mr. Steve Ryan, Board Chair, Health and Wellbeing Queensland, to provide his closing remarks.
Can I firstly acknowledge the traditional owners of the land in which we meet, the Jagera and Turrbal peoples, and acknowledge any elders past, present and emerging from this area. Thank you to all our speakers today. Your insights and honesty today have been very appreciated. And as Chair of Health and Wellbeing Queensland, it has been an absolute pleasure to sit here and witness what has gone on today. I was originally one of the original members of the interim board 3 years ago, and I'm pleased to say I'm still here and still working, I hope, as hard as I possibly can. This is probably one of the toughest gigs I've ever done as a school teacher. I was a school teacher once, and keeping kids in a classroom at 3:10 when the bell's gone or about to go was always difficult. So I hope I can keep your attention for just a few minutes. Can I firstly acknowledge the Governor and the Deputy Premier for attending today and showing their support and their much needed and welcome support for this organisation. It is extremely important in the history of H&WQ. As I said, today has been 3 years in the making. HWQ has led, grown, delivered and shaped an ambitious program of work since its establishment in 2019. Yes, it's only been 3 years. People are taking notice. The time is now for change, and we need to work with one another, for one another, to make change happen, as we've just seen illustrated in that last conversation. Can I acknowledge Robin as the CEO of this organisation for the work that she has done over those 3 years? And can I acknowledge the team that worked very, very hard for HWQ? They are a pleasure to work with. They are tremendous people, and you only have to walk into the building, something I don't do all that often, probably not often enough, but to witness what's going on there. Everything is positive. There is no negativity. We need to reset, reframe, and refocus on prevention. The impact and benefits of prevention are undisputed. Reduced pressure on our health system, increased economic productivity, increased personal health and well-being. COVID has understandably been a big focus for many for so long, but as Her Excellency Dr. Jeanette Young told us this morning, now is the time to put prevention front and centre of government policy and action. And can I echo the thoughts of those people who have made the comment today about the time to influence the policy. Health and Wellbeing Queensland has been working tirelessly with partners, community, the system and individuals, bringing them together and co-designing solutions to improve the health and wellbeing of all and reduce health inequities. One of my passions has been to visit, I haven't visited all of this, but to see that 57 schools and over 15,000 kids are engaged through the Pick of the Crop program, connecting students, farmers and industry groups to improve fruit and vegetable knowledge and consumption. $2.1 million invested in Torres Strait, Cape York and the Lower Gulf over 3 years has successfully engaged 8 remote communities to lead their own local community food security plan, and 5 communities with their own Healthy Stores Action Plan. The list goes on, and there are many of our program partners. Just to mention a few, 6,000 Queenslanders reached through the Queensland Country Women's Association Country Kitchens program. Over 1,600 Queenslanders learnt how to prepare healthy and nutritious meals through the Jamie's Ministry of Food program. More than 10.4 million Australians, 2 million of these in Queensland, saw our Better Than You Remember campaign earlier this year, delivered in partnership with the Outdoor Media Association and Nutrition Australia. The state's A Better Choice healthy food and drink supply strategy was redeveloped and relaunched. Queensland's first public health approach designed to make it easier for Queenslanders to access healthy food and drink options in places outside the home. Over 11.5 billion steps, I've even contributed a few of those, logged from over 450 postcodes and 17,000 Queenslanders through the 10,000 Steps program. More than 3,150 Aboriginal and Torres Strait Islanders had their health checked through our support of the Deadly Choices program. 233 Logan residents, an area very close to my heart, living with type 2 diabetes, participated in a new model of care program which supported 62 student placements, supporting the next generation of allied health professionals. We are working with the university sector to understand and generate novel and robust population, community and other research evidence to enhance prevention. We've partnered on 5 successful research grants totalling $11 million to be administered through the University of Queensland and Monash University. Now is an opportunity for this organisation to reset and achieve lasting impact through action. It has taken us a while to get going. We've done remarkably well in the 3 years, but this symposium represents a very big point in what I hope is a very positive development in the history of health prevention in Queensland. Personally, I would like to thank the Minister, my board, Robin and the entire Health and Wellbeing Queensland team for the endless hours they put into this agenda. I would like to thank all of our partners, many of whom are here today, particularly across the university sector, whole of government sector and health sector for their support. Most of all, thank you to all of our communities and consumers for their hard work. And thank you all for coming here today and taking part in this symposia. It helps no end, and it's fantastic to see so many professional people here and many people who I know have a lot of other things on their plate at this time of the year have made the effort and the time to come here today and to work with us as we roll out what we think is going to be a fantastic strategy and help to the health of Queensland. My background is not just as a teacher, but also as an advocate, and I will advocate very, very strongly for what the professionals, you people, are doing in terms of advancing health for Queenslanders, healthy health for Queenslanders. Thank you all for being here today. I know that there are others to be thanked, and I'm going to pass over to Robin to do that. But can I just thank all the presenters. Loretta, you're emceeing, fantastic, thank you. And all of those who took part in the discussions today. And lastly, but not least, the staff of Health and Wellbeing Queensland, who have done a remarkable job today setting this up and getting it underway. Thanks a lot.